Pricing transparency in hospitals. We are used to shopping for airline tickets, for car rentals, and other services. This is possible because there is a level of price transparency, and the final costs do not change at the end of the consumption of that service or that experience. In healthcare, as we've seen, there is no method to pricing. Pricing transparency is but a nebulous concept at this time. And the idea to ponder is whether price transparency is ever possible in hospitals. Is it practical? Will, would hospitals play ball in encouraging this trend? Pricing transparency in hospitals would mean that healthcare providers will allow citizens, individuals, to shop around, just as one would before buying an expensive item like a car or an airline ticket or an expensive service. Can pricing, outcomes, demographics, comorbidities, and other complexities be reasonably simplified and factored to ensure that comparisons are meaningful? Personally, I have no doubts in my mind that healthcare should be and can be made shoppable. Also, I know that hospital management will resist, and they will have valid reasons to avoid publishing pricing and to avoid promoting price transparency. Most of their arguments or excuses would be around complexities, comorbidities, disease responses, patients are different, it's not linear, and all of this is valid. And this is unlike aviation or hotels or car rentals, and therefore, hospitals' services are not shoppable. But I just want to remind these people who give this argument that as much as what they say is true, there are several hundreds of procedures, several hundreds of medical service categories that are plain vanilla. They're standard, they're undifferentiated, they're predictable. And theoretically, I must be able to shop, at least for these simple, straightforward services. But even here, there is no pricing transparency. If you remember the pricing examples and horror stories I narrated, and you saw the irrationality behind the pricing differences for C-sections and IMRT, I don't have much confidence or faith that private hospitals will give me pricing that's reasonable, fair, or accurate. And I will show you that I'm not alone by demonstrating certain surveys and studies that have been done extensively to prove this. So let's get into this idea of whether and examine whether price transparency can be promoted. Is it practical, given the complexities of our biology, comorbidities, etc.? But before that, a quick slide to show you that there probably is a demand for pricing. In a survey, 82% of patient respondents sought details of financial liability of the procedure and or treatment, but only 11% said that they received any sort of cost details from the healthcare providers. This means that there is a tremendous need and a pent-up latent demand to shop for healthcare, to understand the pricing and costing before taking the leap. Can this be enabled? Is it possible? How practical is this? The key to all of this, as I mentioned, is pricing transparency. What will drive this trend? What are the enablers? And what holds it back? Let us examine this in the next video. Up next.